Assalamualaikum dear students, it's Dr. Maswa Mehtab. Welcome to my YouTube channel Medical School. Today we will be discussing about acute pancreatitis, its introduction, causes, signs, symptoms, complications, treatment and diagnosis. So let's go. I would like to introduce the pancreas. So the pancreas is an abdominal organ. It is just located behind the peritoneum. That means it's a retroperitoneal organ. Now, anatomically, it is divided into three main parts just for the recalling purpose: head, body, and tail. So here you can see we have head, body, and tail, and here you can see the pancreatic duct that opens into the duodenum. Okay. Now, histologically, it has three types of cells. So we have acinar cells that produces the pancreatic juice, the duct cells that line the epithelia of the pancreatic ducts, and then we have the islet of Langerhans. They produce the endocrine hormone like we have insulin and glucagon. Okay, it functions as endocrine as well as exocrine gland. So it gives off its exocrine secretions into the duodenum by means of pancreatic duct. Now come to the main topic, that is pancreatitis, and that's the inflammation of pancreas. It can be acute, it can be chronic. I will be discussing here acute pancreatitis. So it's a sudden inflammation of pancreas, and the causes includes idiopathic, that we don't know the actual cause, and the gallstone. Now remember, the gallstone is the main cause of acute pancreatitis. Then ethanol, that means alcohol consumption. Trauma, if there's any injury to the abdomen, that may cause pancreatitis. And then we have scorpion venom, mumps, autoimmune pancreatitis can also occur. And then the continuous use of steroids, hyperlipidemia, ERCP, and drugs like thiazide diuretic and azathioprine. Now here you can remember these causes by means of the mnemonic, that is I get smashed. Okay, let's talk about the pathogenesis. So the pathogenesis it results from autodigestion of pancreatic substance by inappropriate activation of pancreatic enzymes. Like trypsinogen prematurely gets activated into trypsin, that in turn activates other pancreatic enzyme. Here trypsinogen is a triggering factor. Trypsinogen that prematurely activates into trypsin. So this is the triggering factor of acute pancreatitis. So this may lead to the self-destruction of pancreas. Now here you can see, as I have told you, the main cause is the gallstone. So this gallstone can entrapped within the pancreatic duct. Now this stone can actually obstruct the pancreatic duct, and that may result in reflux of pancreatic juice. That may cause inflammation. As we have discussed, that trypsinogen activates into trypsin, and trypsin activates other enzymes. So these enzymes self-destruct the pancreas, and the pancreas get inflamed. Okay, so these activated enzyme causes interstitial inflammation and edema, proteolysis, fat necrosis, and hemorrhage. Now the hemorrhage is because of elastase, fat necrosis because of lipases and phospholipases, and proteolysis of the pancreas is just because of activation of proteases. Okay, so now let's talk about the type of acute pancreatitis. We have acute interstitial pancreatitis. Now remember, this is not a severe condition, it's just a mild form of pancreatitis. It's characterized by interstitial edema and focal areas of fat necrosis. The second condition is acute necrotizing pancreatitis. So as the name suggests, there will be necrosis of three cells that we have discussed. We have histologically three cells. So these are the acinar, ductal cells, and islets of Langerhans. Now remember, this is the moderate form of pancreatitis. The most severe condition is acute hemorrhagic pancreatitis. Now in this condition, you will see the parenchymal necrosis with diffuse hemorrhage. Let me show you this in this picture. So this is the acute interstitial pancreatitis. The pancreas is swollen and red. However, in this condition, you can see there is diffuse bleeding, and then we have here fatty necrosis. Now, how will the patient present to you? The patient will complain of abdominal pain that is mainly confined to the epigastric pain. Remember, this will radiate towards the back. As I have told you, it's a retroperitoneal organ, so this pain will radiate towards the back. Now, this pain can be relieved when a patient sits forward. So this will help you in differential diagnosis. Okay. The patient may feel nausea and vomiting, fever and jaundice, and then we have these signs like Cullen signs and Gray-Turner sign. Now these are very uncommon conditions, but they can occur especially in the patients having acute hemorrhagic pancreatitis. Okay, now this is the Cullen sign. This is discoloration, hemorrhagic discoloration of the skin around umbilicus. So this is the periumbilical discoloration of skin that is called as the Cullen sign. However, in the Gray-Turner sign, you will get the discoloration or hemorrhagic discoloration in the flank region. So the diagnosis is mainly based on the clinical examination. We have discussed the clinical presentations and then the lab testing. So you have to go for the amylase. You have to see the serum amylase that will be elevated in first 24 hours. However, the gold standard test is serum lipase because amylase can be elevated in other conditions like infarction of mesentery, and then we have ectopic pregnancies. But the serum lipase, this is only elevated in the condition of pancreatitis. Okay, then you should go for the abdominal x-rays and CT scan, which is the best imaging study. Okay, treatment. So how will you treat the patient? You have to admit the patient and suggest NPO and IV fluids, IV antibiotics. As I have told you that the main cause is gallstone, so you have to remove the gallbladder along with the stone. That is to say, go for the cholecystectomy. Okay, if you don't treat the patient very well, what will happen? There will be some complicated conditions like DIC, that is disseminated intravascular coagulation, systemic organ failure. The patient may develop diabetes. As we know, the pancreas is the main organ which secretes insulin. So if there is any damage to the pancreas, there will be less insulin and diabetes will be developed. Okay, then the condition may be complicated to the chronic pancreatitis, pancreatic abscess and pancreatic pseudosis. So that was all about acute pancreatitis. Thank you.